I've watched 3 people die because they ignored a smell. Not smoke, not gas, something stranger, something their own body was screaming at them to notice. One was a guy named Marcus. Burning rubber, that's all he could smell. Every single day. At work, at home, sitting in traffic. He tore his life apart looking for the source. Checked the tires, the vents, paid an electrician to gut his house twice. Found nothing. His wife thought he was imagining it. His co-workers whispered that he was losing his mind. He wasn't crazy. He had a brain tumor, and that tumor was crushing the exact part of his brain that processes smell, forcing him to experience a phantom odor that existed nowhere but inside his own skull. Marcus got lucky. He saw a doctor. Most people don't, because they assume it's something out there in the world, something they can fix with bleach and air freshener. They can't imagine the smell is coming from inside them. Here's what most doctors won't lead with. Cancer has a smell. Not always, not in every case, but often enough that you need to know. Today, I'm walking you through 6 smells that can signal malignancy. What they mean, why they happen, and what to do if you notice them. I'm Dr. Sam Brown. I've seen hundreds of cases where one overlooked symptom, including smell, made the difference between stage 1 and stage 4. Let's start at number 6, ammonia breath, kidney cancer. If your breath smells like cat piss or cleaning solution, your kidneys aren't filtering waste the way they should. When kidney function drops, urea builds up in your blood. Your body tries to dump it any way it can, including through your lungs. That's the ammonia. In oncology patients, this shows up most in advanced kidney or liver cancer when the organs have lost the ability to detoxify. Studies show that in end-stage renal failure, blood ammonia levels can spike 10 times higher than normal. Here's the uncomfortable part. By the time you're smelling ammonia on your own breath, your kidneys are already in serious trouble. Number 5, acetone. Liver cancer. This one's tricky because a lot of people on keto assume the fruity nail polish remover smell is just ketosis. Sometimes it is, but not always. When your liver can't process fats and proteins properly, whether from cirrhosis, hepatitis, or cancer, your body starts breaking down fat for energy and producing ketones. Those ketones give off that sharp, sweet acetone odor. In liver cancer patients, we call it liver breath. I had a patient a few years ago who came in thinking she just needed to tweak her macros. She'd been keto for 6 months and figured the smell meant it was working. Turns out she had a 9-centimeter mass in her liver. Keto had nothing to do with it. If you're not on a restrictive diet and you're smelling acetone, or if you are on keto but also feeling crushing fatigue, turning yellow, or having abdominal pain, don't write it off. Number 4, phantom smells. Brain tumors. Let's go back to Marcus. Burning rubber. That was his phantom smell, but for a woman in Ohio named Rachel, it was burnt toast. For another patient, gasoline. The specific smell doesn't matter. What matters is that no one else can smell it, and it won't go away. This is called parosmia or phantasmia. It happens when a tumor damages the part of your brain that processes smell, usually the frontal or temporal lobes. Your brain misfires, creating a sensory experience with no external source. I used to think this was rare. Then I started asking about it during intake. Turns out about 1 in 8 patients with brain tumors report some kind of smell distortion in the months before diagnosis. Most never mentioned it because they thought it sounded insane. Here's what you need to know. If you're consistently smelling something no one else can smell, and it's been going on for more than a couple weeks, that's not stress. That's not a sinus infection. That's a neurological symptom, and it needs imaging. Number 3, rotting meat. Advanced stage cancer. This one is brutal, and I'm not sugarcoating it. When a tumor grows large enough, especially in breast tissue, lung, or skin, it can outgrow its own blood supply. The center dies. That's called necrosis. And necrotic tissue smells exactly like what it is, rotting flesh. I've walked into exam rooms and smelled it. before I even saw the patient. It's unmistakable. And it usually means stage 4, or very close. The patients who come in at this point often have visible ulcers, open sores, masses that won't heal. They've usually known something was wrong for months, sometimes years. They didn't come in because they were terrified, or uninsured, or convinced themselves it would get better on its own. It didn't. If you or someone you know has a wound that smells like decay, you need to see a doctor immediately, not next week, not when you have time. Now. Number 2, foul-smelling stool, colorectal cancer. I know this isn't comfortable, but it's too important to skip. Your stool is supposed to smell. That's normal. But if it suddenly smells far worse than usual, rotten, putrid, like something died inside you, and especially if it's dark, tarry, or streaked with blood, that's a red flag for colorectal cancer. Here's why. Tumors in the colon or rectum bleed. They obstruct the passage of stool, letting it sit and ferment, and they alter the bacterial environment in your gut, your microbiome, which directly changes the smell of what comes out. One of my patients described it as the worst smell I'd ever experienced, and it was coming from me. He was 54. He'd been putting off his colonoscopy for 3 years. By the time he came in, he had a tumor the size of a plum. Here's the thing. Colonoscopies are uncomfortable. I get it. But they're done under sedation. You're asleep, you feel nothing, it takes less than 30 minutes. And it's the only way to catch colorectal cancer early. You can't feel it. You can't see it from the outside. There are no lumps you can touch. If you're over 45, or you have a family history, or your stool has changed in smell, color, or consistency for more than 2 weeks, get the scope. I've had patients tell me they can't afford it. Their insurance won't cover it. It's not available near them. I hear you. But here's the truth. Your life is worth more than the cost of that procedure. Find a way. And number 1, foul breath. Cancers of the head and neck. This is the most common smell-related symptom I see in my practice. Chronic, severe halitosis. Not morning breath. Not garlic. The kind of smell that makes people step back when you talk. The kind mouthwash doesn't touch. The kind that's there all day, every day. It shows up most in cancers of the tongue, throat, tonsils, larynx, and sometimes the sinuses or jaw. And it happens for 3 reasons. First, tissue death. Tumors in the mouth or throat destroy surrounding tissue, and that dead tissue releases volatile sulfur compounds, the same chemicals that make rotten eggs reek. Second, infection. Tumors create pockets where bacteria thrive. Those bacteria feed on dead cells and mucus, and the waste they produce smells exactly as bad as it sounds. Third, dry mouth. Some tumors affect the salivary glands or the nerves controlling them. Less saliva means more bacteria, more debris, more odor. I had a patient, a high school teacher named David, who started noticing his students lean away during class. He was meticulous about hygiene, brushed 3 times a day, used mouthwash, chewed gum constantly. Nothing helped. When he finally came in, I found a tumor at the base of his tongue. Small, about the size of a grape. But it had already started breaking down the tissue around it. He told me later he'd noticed it 6 months earlier. He just kept hoping it would go away. Here's what I need you to understand. Bad breath by itself isn't cancer. Phantom smells by themselves aren't cancer. But if you've got persistent halitosis plus pain when swallowing, or a sore that won't heal, or a lump in your neck, or a change in your voice, those things together are a pattern, and patterns matter. Most people wait. They tell themselves it's nothing. They're busy. They'll deal with it later. I get it. It's terrifying to think something might be seriously wrong. It's easier to ignore it and hope it vanishes. But I've been doing this for over a decade, and I can tell you with absolute certainty, The patients who survive are the ones who come in early. The ones who don't wait for symptoms to become unbearable. The ones who trust their gut when something feels off. Your body is smarter than you think. It's constantly sending you signals, through pain, through fatigue, through lumps, through smells. It's trying to get your attention. Listen to it. If you've noticed any of these smells or anything else unusual that's persisted for more than a couple weeks, don't ignore it. See your primary care doctor. Ask for a referral if you need one. Push for imaging or blood work if your doctor tries to brush it off. I've had patients tell me their doctor said it was probably nothing and sent them home. A year later, they were stage 4. Don't let that be you. Next time, I'm talking about cancer symptoms that show up on your skin. The ones that don't look like moles. The ones most people completely miss. Make sure you're subscribed so you don't miss it. And if this video made you think of someone who needs to hear it, send it to them. You might save their life.